Hello, everyone. Welcome to my table, to this big October Wellness Challenge. And today I will be talking to you about pain and how we can manage pain without medications. And I think this fits in very well to some of this discussion you probably have been having in some of your classes and webinar. And since we're focusing on wellness, we really want to push this education to focus on self-efficacy management, things that you as an individual can do yourself instead of relying on doctors or other people to do it. So I hope that this is going to be a relevant topic to you, to give you some skill sets to help educate you on how you manage pain using other means outside of medicine. All right. So here, I think if you're here and you're a person with MS or you're a caregiver, you may have some appreciation for some of these things that can come with MS that actually implicate function. So why this is important to me is that I'm a physical medicine and rehabilitation specialist. So I focus on function. What is it that your disease state or your impairment or your pain prevents you from doing? So as we look here, some of the problems that individuals with MS will have: vision problems, depression, fatigue, muscle spasms, something that I'll be talking about in one of my other tables and webinars. I'll also be talking about spasticity, bladder issues. But today, the main focus here is talking about pain and how that can be managed without medicine. So before we get into talking about non-pharmacological approach, I think it's a good idea to really have a better understanding of what pain is, because one of the things I've recognized is that there's a lot of misconception about what pain is. And I think we tend to equate pain to just tissue damage. I hurt myself, I broke a bone, something got torn. That's when I have pain. That makes sense, but that's not the whole story. So here I wanted to present to you the definition of pain according to the International Association for the Study of Pain. And basically, through their definition, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So what does this mean? The big concepts here for you to recognize is that pain has this two big component. You have a sensory component, which is unpleasant, and there is an emotional component. And a lot of times in traditional medicine, what we focus on is we focus on the sensory component. We'll be able to give you medicine that can block the pain. We can do injections. We can do botulinum toxin. We can do all of this stuff. But the emotional component is very significant and real. And in fact, we know that when we don't treat the emotional component of pain, the sensory component, when we treat, does not help. So the big point from this slide, if you leave this presentation, the understanding I want you to get is the idea that there is this two component of pain, the sensory and the emotional component. All right. So pain is a sign that something is wrong. So a lot of times when individuals have pain, from a physiological standpoint, we think there is a biological derangement or something is wrong. But pain has different meanings in different contexts. So from a psychological standpoint, I talked about the emotional aspect of pain. And then there's behavior. Pain changes our behavior. When we have pain, we don't want to go out and hang out with our friends. We don't want to go to our grandchildren's soccer games because we can't sit for too long. It can also affect your thinking, your cognition. There is some spiritual implication, and even cultures. In different cultures, we see pain differently. So pain has all of these elements that goes into understanding that, to be able to get a baseline of what pain is and therefore how do we treat it. So specific to this group and specific to this audience, what we're talking about is pain specifically in MS. And if you're a person or a caregiver with MS in this space, this is not a new concept. But what I wanted to stress here is this idea of neurogenic pain, because MS does affect the nervous system and affect the myelin. You have pain that are not the classical inflammatory pain, like you have an arthritis of your joint. So here you have neuropathic pain or neurogenic pain. And this pain is very difficult to control. And there's a few examples here that some of you here may be familiar with. But the idea is that we can give you some strategies at the end of this presentation to be able to give you some tools to add to whatever you have in addition to your medicines or whatever else you're using to be able to help you manage your pain. All right. So more important is to talk about the experience of pain. The experience of pain is very, very specific and individualized. Your experience of pain is very different from everyone else, okay? And we can have magnification of that experience because of how long it's been going on. The experience of pain can be amplified, can be changed by the weather. Sometimes when individuals that have chronic migraines, or even if you have neurogenic pain or neuropathic pain as an MS patient, when the weather changes, you can note some of those pain decrement or increment as a result. There is also our perception and belief systems. Am I ever going to get better? All of that also plays into our ability to have a good relationship with pain, because you can have a bad relationship with pain and you can have a good relationship with pain. In this context, we want you to have a good relationship with pain, okay? We also know that stress of chronic pain can lead to fatigue, insomnia, and muscle tension. And this is something that you already have as a person with MS. So really having some ways to manage some of this experience, things that you have control over, can even limit your fatigue, can limit your insomnia, and some of those tensions that can come as a result of stress. And in other tables, I will be talking about the stress or the relaxation response. So that's something that you may also want to check out to give you some ideas of what that exactly looks like. Psychologically, you may feel anxious, depressed, abandoned, and then from a behavior standpoint, people can become withdrawal. Important concept before we get into talking about the complementary options for pain is this relationship between pain, emotion, and cognition, okay? So sometimes you can't do anything about the pain, but you can control your emotions, and you're responsible for your emotions, and you can control your thinking and your thoughts. So the idea here is that we have this basis of understanding the relationship between your pain and your thinking, and that gives you some power as a patient to be able to control your pain with your brain, okay? So we know that when pain does not get to the brain, we don't feel any pain. So there's so much we can do now with an understanding of neuroscience, of the power of our mind in managing pain. And I think there's a lot of classes here in this conference talking about meditation, mindfulness, all of those things actually helps you to be able to manage your emotions as well as cognition, all right? So let's just look at this relationship. So we do recognize that chronic pain is now a disease of the brain, okay? So when you have chronic pain, there's all these changes that has happened within the brain. How you're processing pain has changed, meaning pain that has gone on for more than 6 months, all right? So when so individuals that have MS may have chronic pain, and you can have some intermittent episodes where pain get worse. But overall, there's changes in the brain. And we know that when you're sad, your pain actually goes up, right? When you're sad about your pain, something is bothering you, people tend to have more pain. And then when you're angry, your cognition, your thoughts, you're focusing on something that really irritated you because of what else is going on in your life, that itself can also implicate your pain. When you have good thoughts about your pain or good stories about your pain, we know that can improve your pain. And there's tons of literature and research actually linking all this relationship. And I think this is something that I want you to really get from this presentation. So I think the first concept was sensory and emotion. And the second big concept is this relationship between pain, your emotion, and your cognition. Your emotions, your cognitions, you're responsible for them. So you can do something about that to help with your pain. All right, now let's dig into this complementary approach. So a lot of individuals with MS have explored complementary alternative medicine. So let's really define this to get clear on the same, be on the same platform. So mind and body. So when we look at complementary alternative medicine, we can group that into mind and body practices as well as natural products. So the mind and body includes some acupuncture, massage, meditation, yoga, some of the elements that we're talking about here. And then the natural products include vitamins and other supplements. Okay. It is also important to get a clear distinction between what is complementary and what is alternative medicine. So a lot of times we put all of this together, we call it CALM or complementary alternative medicine, but they are actually quite different. So when we're talking about complementary medicine, this involves using a non-mainstream approach together with conventional medicine to help with a specific problem. So for example, if you have spasticity and you're using baclofen for your spasticity, and you also are doing some yoga, some Pilates, some meditation to help relax muscles, to help you manage your symptoms, that will be considered complementary. On the other hand, alternative medicine is using a non-mainstream approach in place of a conventional medicine. This is not something that we do recommend per se, but again, in combination, this is something that can help with some of our patients. And the biggest point about all of this discussion about complementary option is the idea of safety. Okay, there's so many complementary options out there. How do you know as a patient what is the right thing, what is the safest for you? But when it comes to safety, it depends on what you're doing. Okay, so here there are some recommendations that we have to think about when we're exploring complementary alternative medicine. So something that might work for a healthy person, somebody who doesn't have MS, somebody who doesn't have some other disease state, may not be the right thing for you. So you always want to talk to your doctors about exploring complementary options. It's also very important if you're going to go start any of these practices to make sure that you talk to your provider, whoever is going to be doing this mind, body, or specific complementary treatment, to understand that you have MS, so they have a sense of what your disease state present clinically, as well as other potential risk factors. So then you have the right treatment done to prevent further complications. Okay, and I think this picture speaks volume of what this idea of something being natural, and we have to be careful, because a lot of times individuals will say, you know, I don't want to take a pill, but I'll take a supplement. You have no idea where that supplement came from. So please, let's really get this in our head. Like, natural does not mean safe. And what is safe for somebody may not be safe for you. So this is something for you to think about, okay? So now specifically what we know about MS and complementary medicine, we know about 70% of individuals with MS actually have used some level of complementary medicine, okay? And we know that from MS, we don't have a cure. This is something we hope to be able to get to. But we know that conventional medicines with disease-modifying drugs can reduce the number of flare-ups or relapse, as well as progression of disease. So from a complementary standpoint, we don't have anything that will do anything close to what conventional medicine does. But we know that individuals have tried different specific complementary options, including specific diets and dietary supplement. And we'll talk about some of the science behind some of these ideas, okay? So what does the science say about complementary medicine and multiple sclerosis? So we know that certain health practices such as yoga may help ease with some of the symptoms of MS. There are some limitations there. However, we know from the science that there is no evidence that any dietary supplement is effective for multiple sclerosis, okay? So this is something that you want to be aware of. And now let's dig a little bit deeper into specific modalities that actually have evidence for supporting what we do with MS patients. So practicing yoga can help with fatigue and mood, but we know that there's no relationship between that and your mobility as well as thinking abilities. Okay, so it doesn't affect your cognition, but there's some benefit with fatigue and mood. And we can kind of make some inference about, you know, fatigue getting better, mood getting better, implicating your function or your mobility. But again, we can't make that link directly, okay? We also know that there's been studies looking at acupuncture for MS symptoms. However, there is some limitation on how the study is designed. But again, when we're looking at all of this, how I want you to approach this is looking at safety and efficacy. If you don't have a huge safety concern, this is something you can explore, and there's some patients who get benefit from it. Reflexology, there is some data that may show that it does decrease neuropathic pain, but we need more studies to be able to make those type of recommendations. Dietary supplements, a lot of people take supplements, including myself. So fish oil has not been shown to improve MS. It maybe help with your cardiovascular health through changing your cholesterol or your metabolic state, but not helpful for MS. Ginkgo has not been shown to enhance the ability to think. I think a lot of people take ginkgo to think that this will help with cognition. That is not the case. Vitamin D, there's a lot of talk about vitamin D, multiple studies. We know that vitamin D may be a risk factor for long-term disease activity and progression. However, we don't know that taking vitamin D in specific amount may prevent MS. All right. So now we are in 2021 and we've had a pandemic. And even before that, the internet is everything, and internet of everything is coming. Everything is getting connected. So there's so much information out there when it comes to complementary alternative medicine. Okay, so when you see something online, when you read information about a specific product or an app or whatever, there are some specific questions you need to ask yourself to make sure that you're getting information that is relevant and also coming from credible sources. So you want to understand who's running that specific app or site. Can you trust them? What are they promising to offer? If something is too good to be true, you want to be careful with those things, okay? And has the information written been reviewed? Is it up to date? Sometimes you may read something that was maybe 1998, something like that, maybe not that far away, but a lot of times you want to make sure that that information is up to date, because we are always learning new information. All right, who is this coming from? Is this based on science? So you want to make sure there's truth in the information that's being pushed out there. And what are they trying to sell you? So I think these are some things for you to think through as you look to explore information online. And to really help you with all of this, there's tons of resources out there. And I have here from the National Institute of Health on complementary medicine. So this is a place you can go to check out a lot of resources there. This is Know the Science. There's a lot of fake health medical news out there these days. So we want to make sure that you are educated, know the science. So here are some links to specific places you can go educate yourself. This is more information from the National Library of Medicine, looking at mobile apps and other complementary options, as well as from the CDC. All right. Well, thank you for your time. I know this was a very fast process of going through this material, but we wanted to get this thing done within a 20 minutes time period. So the major point of this presentation, we know pain affects a lot of people, and pain has two components. There's a sensory component, there is an emotional component, and you can control all of those with your cognition, your thinking, your thoughts, and your mood. Okay, so that gives you some power there. So there is multiple complementary options that you can explore. These include mind-body practices, new supplementations, and dietary supplement, which you've all looked at. And all of those do have some benefits in managing your pain. And the point is to understand that something that is natural does not mean it's safe. So I want you to think about that. Thank you for your attention. I'm going to be talking about other topics, so come check out my table, and I look forward to answering any questions for you. Take care.